Welcome back. You are watching Trending News right here on Look Up TV, and thank you so much for staying with us. And now let's continue. The Health Ministry is now in pursuit of acquisition of 1 million doses of vaccines, each from Pfizer as well as Johnson & Johnson respectively, to supplement the AstraZeneca vaccines. Speaking to the press at the Afia House office while receiving donations of personal protective equipment worth 2.3 million shillings donated by the MultiChoice Kenya, the Cabinet Secretary for Health, Mutahi Kagwe, say that hospitalization rate and those being admitted into intensive care unit continues to be high. Our reporter Dorothy with more on that story.
Health Ministry is now in pursuit to acquire 1 million doses of vaccines, each from Pfizer as well as Johnson & Johnson respectively, to supplement the AstraZeneca vaccines. According to the Cabinet Secretary, Ministry of Health Mutahi Kagwe, hospitalization rate and those being admitted into intensive care unit continues to be high. Currently, 108 patients are in the intensive care unit on ventilatory support, while 70 on supplementary oxygen, according to the Ministry of Health. With delays in the arrivals of AstraZeneca vaccine, which had been rolled out in Kenya for the first dose, the government have been forced to outsource from other areas. The CS Ministry of Health attributed that the government has only 3 sources where it acquires the vaccines. They include government-to-government, COVAX facility, African Union. The African Union, which Kenya is yet to utilize, has negotiated with Johnson & Johnson to enable countries purchase the vaccine at discounted prices. Meanwhile, the government banned the private sector role in vaccines because of the confusion it created, as well as people taking advantage to sell them, yet the government provides it at no cost. Health CS Kagwe still urges Kenyans to strictly adhere to the containment measures until the cases drops. For Look Up TV, Ruth Yodondi.
Thank you, Dorothy, for that story. And now let's cruise over to our neighbors in Tanzania. A month after forming the COVID-19 task force, Tanzania President Samia Suluhu has officially received the coronavirus report assessment of the country. The committee was formed after President Suluhu took office following the death of her predecessor, John Pombe Magufuli, who was a COVID skeptic. As Brian Amoy reports, President Samia received the report a few days after urging Tanzanian citizens to start wearing masks to protect themselves against the virus.
While swearing in new government officials at State House, Dar es Salaam, Tanzanian President Samia Suluhu was presented with a report of the COVID-19 assessment in the country by the committee chairman, Professor Said Aboud. In the report, the committee recommends the government to give COVID-19 updates, give information about the virus and put in place measures to prevent a third wave from hitting the country, put in place emergency plans and disaster response. Health workers were urged to use their know-how to perform their civic duty in informing and educating the public on how to prevent and treat COVID-19. The country was urged to join organs involved in decision-making and adhere to resolutions that are being used in the East African Community, the South African Development Community, the African Union and the World Health Organization. The government was urged to join the COVAX facility for easy access to vaccines. At the same time, it was recommended that Tanzanians should be free to use the vaccine they prefer, while the government was urged to put in place facilities to manufacture vaccines locally. The task force also recommended people above 50 years, people with underlying conditions, security apparatus and people traveling abroad to be vaccinated first. The report also urged religious leaders, the private sector and the media to join the government in spreading awareness about the virus. The economic impact of the virus in the country has widely been felt. According to the quarterly economic bulletin of the Bank of Tanzania, growth of credit to the private sector by commercial banks dropped to 2.3% in March 2021, largely due to the impact of COVID-19 pandemic, from 8.6% in 2020, while in the 2019 first quarter the growth was at 9.6%. The move to take action is seen as a shift from the hardline stand that had been taken by her predecessor, the late Dr. John Pombe Magufuli. During his tenure, Magufuli declared the country free of the virus and went ahead to advise Tanzanians to turn to alternative means to treat the virus. The country's last communication about COVID-19 numbers in the country was on May 2020, when it recorded 509 cases and 21 deaths. Following the change of guard and the new report in place, Tanzania seems to be set on a new journey of acknowledgement and all-out war against the virus. For Look Up TV, I'm Brian Amwai.
Thank you, Brian Moy, for that report. And now back to the country. The tea reforms are now taking shape following the presidential order on the immediate reforms on the tea sector. This decision comes after a long period marred with corruption and bad leadership. The new policy, regulatory and administrative framework is meant to re-energize the ailing tea sector in the country. Agriculture CES and security counterpart, Fred Matiang'i, have vowed to effect the presidential orders for the benefit of the farmers. Agriculture CES Peter Munya said that the major problem facing tea value chain was a dysfunctional and inefficient tea auction system characterized by lack of transparency, accountability and competition, which results to manipulation and cartelization by value chain players, leading to low prices and poor earnings to tea farmers. And we've come to the end of trending news right here on Look Up TV, and do stay with us as we'll be keeping you up to date with the stories on the by-elections in Juja, Bonchari as well as Ruri Ward in Nyandera County. As always, this is trending news and we keep you up to date with stories that are making headlines in the country and the rest of the world. I am Nancy Nalima. Thank you so much for watching.